Um, okay, I'll start talking a little bit about what we're going to do here. Obviously, I think most of most of you joining us will have known that we've been aggregating COVID-19 news from the federal, state, and local levels since March, and we've done a lot of original enterprise reporting on sort of first and second order effects of the pandemic, all the ways it's affecting the political, economic, cultural life of our region. So, but this is our first panel event. So I'm really thankful that you're all joining us. Just a little bit of housekeeping here. We're going to go for an hour and a half. I'm going to guide the conversation through various topics, including public health, government policy, the vaccine, and then the pandemic's impacts on the economy, housing, and tourism. But I'm going to try to steer into the format provided by the fluidity here, or the fluidity provided by the format. And I'm going to encourage all of you to leave questions in the chat just throughout the conversation, and I'll weave those in to the appropriate sections, and then we'll have a dedicated time at the end for general Q&A. But to keep things from descending into chaos, please keep yourselves muted throughout. Let's see. I want to thank everybody for joining us. Thank you, Sam Leota, Director of Creative Partnerships at Chronogram, for the technical support and setting up the Eventbrite page and everything. And I want to thank all of our guests too. I'll allow them to introduce themselves here. Why don't we start with you, Lissa?
Sure. I'm Lissa Harris, and I have been the River's COVID-19 correspondent, sort of steering the ship of our regular roundups since mid-March. And it has been quite a journey, and we've learned a lot. My background is in science writing. I have a degree in science writing, but I have been involved in local news for a long time. I started a website called the Watershed Post in 2010, and we ran that until 2017. I'm based out of the Catskills, and I grew up here. So I'm kind of straddling the worlds of science and local journalism and disaster news. I was here for Hurricane Irene and the flooding and did a lot of work on that. And that, I think, has sort of informed what I'm trying to do here with the River and with COVID-19 coverage, and with trying to get good science and good information married to really micro level local news. So that's what we're about here.
Diana?
Yes, thank you. I'm Diana Mason. I am a registered nurse. My area of expertise is public health, although I don't work for health departments. I'm a professor emeritus from Hunter College, and I have an affiliation now as the senior policy service professor at George Washington University's Center for Health Policy and Media Engagement at the School of Nursing. I also, though I live up here in the Catskill region, and I produce a radio program that's bi-weekly on WIOX radio called HealthCetera in the Catskills, and I sit on the board of the Margaretville Hospital. I'm actually grateful to Lissa Harris because she opens most of my programs with an update from the River Newsroom, and it's really an important part of the program, and thank you, Lissa, and thank you, the River Newsroom.
Wilfredo?
Hi, everyone. What a great opportunity to be here. My name is Wilfredo Morel, and I work for Sun River. We just acquired that transition. We used to formerly call Hudson River Healthcare. But because due to our expansion all the way from the other upstate, which is Long Island, to the Hudson Valley region and the 5 boroughs, we merged, and so it's Sun River. I am Director of Hispanic Health. One of my pieces is in policy, especially as part of the New York AIDS Council, and also an advisor to the Governor Task Force, which is the end of AIDS, which is basically one of the pieces that I've been doing for almost 30 years. And of course, working as a Director of Hispanic Health has been quite a challenge, especially in our immigrant population. And when it comes to Hispanic, Hispanic and then immigrants. There, we needed to find a way to bring everyone together because after finding out that in the state of New York, we have 4.2 million immigrants, in which most of them reside in New York City, and of course, soon to be in the Hudson Valley region, we really need to have a plan of action. And I think that this open conversation that we have here will in some way touch on all that. So thank you again for the invitation, and let's see where we go from here.
I should note for everybody that Wilfredo is going to have to jump off shortly after 5 to join a last minute call with the state leadership. So get your questions in for him early. Next, we'll go to Jonathan Drapkin.
Thank you, Phillip, and thank you to the River for hosting this. I'm Jonathan Drapkin. I am the president and CEO of Hudson Valley Pattern for Progress, which is a regional planning and policy organization. We've been around since 1965. We work in 9 counties: Westchester, Rockland, Putnam, Dutchess, Ulster, Orange, Greene, Columbia, and Sullivan. Since the pandemic, though, I feel as if I've been drafted to also work for the state uncompensated. I'm a member of the regional control room for the Mid-Hudson. I've been long time, since its inception, a member of the Regional Economic Development Council for the Mid-Hudson. I do a number of special projects for the state since this has happened. And I think we all have our own personal experiences, and the engagement of this has been both horrible in what occurred and fascinating insofar as it's led me to do a podcast called Patterns and Paradigms, which is how all of what has happened since March could possibly take us to a better place. So that's my note of optimism about this.
Phillip, did we lose you? Well, I'm not here. I don't know if Phillip is currently with us, but Marybeth, can you introduce yourself?
Oh, sure. I'm Marybeth Mills. I'm the owner of the Peekamoose restaurant in Big Indian. I did for many moments think that Lissa had made a mistake by inviting me, because I am more of a one-trick pony than everyone else here on this panel. My husband and I have owned this restaurant for the last 18 years. We moved up from New York City with a very vast, wonderful experience working in the restaurant field there. During this pandemic, we were honored to be part of Project Resilience throughout Ulster County and Feed the Frontline, which was more towards Delaware County, organized by some dynamic people. And yeah, just happy to be part of this.
I am so glad that you found the time in your restaurant life to be here with us. That's it's
Thanks.
not easy what's been literally put on your plate.
Right.
Do we have Phillip with us?
Yeah, I apologize for the technical difficulties. Very poor form on my part.
I felt very powerful for a minute here, but I'm gonna get the reins back.
Yeah, thanks for stepping in there, and thank you, Marybeth, for introducing yourself. Okay, so we'll get started here. I want to start with just kind of a catch up on where the state of the pandemic right now. So throughout the fall and summer, like things seemed relatively calm, but the virus is obviously surging now. And over the past few weeks, we're seeing the beginning of what some officials in the Hudson Valley and Catskills are calling a second wave. So I'll direct this question at Diana, Lissa, and Wilfredo. Maybe Diana, let's start with you. Where are we at right now, and what's driving this uptick?
So when you say we, as a nation, we're out of control.
Mm-hmm.
It's frightening what's going on in the nation. We are not as bad as the Midwest is. However, our numbers are creeping up as well. So I was just looking at Delaware County yesterday, and I believe there were 6 new cases. Now the total, we haven't even reached 300 yet, but be mindful that we're a very rural area and we don't have a large population. And the trend is what you want to pay attention to, and the trend is going up. And so I think it is a time, and this was predicted. Everybody's moved inside, and the virus, as long as when we are outside, the virus doesn't like ultraviolet light. And so the idea that we're moving indoors and losing that sunlight, the scientists were predicting that this would happen. So I think we're in a dangerous place, and I think it behooves all of us to be mindful that this could get much worse up here. In fact, Wilfredo was just sharing with us about that Westchester, you just got notice that an area that you're in turned to yellow just 10 minutes before you came on.
Yes, that's quite a good segue. It is indeed frightening. I will say that, yes, I think that we had kind of fell to sleep or got too comfortable in a very short matter of time, not understanding that there are seasons. And depending on the seasons, we need to also be proactive because this is a virus that we're still trying to learn, because for all I know, it can also live within the fall and the winter. Therefore, to have that kind of awareness and that kind of mentality is where intervention and prevention can take a good place. And for example, again, a few, maybe 30 minutes ago, I heard that in our community right here in Northern Westchester, we just turned yellow, but I think that we have been, because the yellow doesn't mean that it's the end of the world. If anything, it's really saying, hey guys, before going to the red or the orange, let's try to maintain here and reverse that. Now, the biggest challenge is how do we do that in a community where, number one, and I'm not going to say that it's just that all of us, it's one should fit all, but is the diversity that exists within, is the culture, is traditions, is language, is all those things, and then it's education. So I think that, to me, one of the biggest deal will be the whole education in prevention and intervention, that we need to be very proactive. Because I hear the first thing is the testing, and then everybody wanted to know about the vaccine. But why don't we think about a way of preventing and stay, so that we cannot go into the next zone. But right now, it is concerning. And I'm going to say it also, the other thing is that everybody will look into the school. Oh my God, the school, we had to shut down the school. I think that the whole situation is really the us, especially public spaces, places, and all this stuff. As a community health center, our biggest thing is to be proactive, education, prevention at all time, and that's what we now are gearing to. And our conversation, we have some team in which I will mention that later on. But thank you for that highlight.
Just want to jump in and just put in a note. One of the things that we've been really following along here with at the River is not just, how is the virus spreading and in what settings is it spreading, but what are the policies that the state and the federal government are putting in place to deal with it. And, there's a lot of focus on personal responsibility, and we all do need to do our part in order to try to protect ourselves and the people in our lives and the people in our communities. But at the same time, there's been a kind of a vacuum of policy that is really allowing for supporting people in doing what they need to do, in staying home, and not coming to work when they're sick. Early on, we had some expanded unemployment. We had a little bit of a stimulus payment. We had some policy that was maybe making it a little bit easier for people, in New York State and around the country to buckle down and get through a contraction of our lives, both economic and personal. But we didn't really fully commit to that contraction, and we didn't really fully commit to supporting people to do that. And now, we're seeing the I think the very predictable, as Diana said, scientists have been predicting this. It seemed clear that this was where we were going to go if we didn't take significant policy action to support people in a really intense ask to curtail their personal lives and their economic activity.
And if I could add that I saw there was a question in the chat about handling of cold food. I think people need to understand that this is primarily, first and foremost, a respiratory virus. So as you move indoors, you've got a contained space. You're breathing whatever air is there. And so the idea when you're outside, the air is moving. Yes, you want to social distance. Yes, you want to wear a mask even when you're outside. But this movement indoors is key. And I think it's key when we start talking about businesses being open. I think it's key when we talk about Thanksgiving and what we're thinking about with Thanksgiving. And so keep in mind that, and in fact, I was just reading something today about this, the surface cleaning that we were all doing in the spring, that we don't have to be probably so obsessive about that it really is more important to focus on the air and the quality of the air and the movement of air and fresh air.
I want to pick up on the note of policy initiatives and introduce a reader question that was submitted during registration. They write that Michigan recently mandated restaurants and bars to contact trace all dine-in patrons. And California just passed a bill that mandates employers notify employees of any potential worksite exposure within one business day. I know Lissa and I have noticed as we're gathering up the news 3 times a week that the county health departments and the businesses certainly are widely divergent in how they're notifying, or even if they're notifying the public about potential exposures. So should other states follow these examples from like Michigan and California and have more of a mandate? What do you think about that, Dr. Mason?
So one is that I have concerns that Delaware County and other people I know have concerns that Delaware County does not report where the confirmed cases are. They are reporting when there's a hot spot, but they aren't reporting where the confirmed cases are. And so from the standpoint of having a knowledgeable community about where are maybe some hot spots emerging, there's some concerns about that. I think the other thing with the idea of contact tracing, the policies to me should have been put in place very early on that you wear a mask. Yes, it's a personal responsibility, but so is wearing your seatbelt. So is the idea that you cannot abuse your child. We have a lot of laws in this country that are for which if you don't follow them and you get found out, you are fined. You can't even go to jail for it. I'm not saying people who don't wear a mask should go to jail, but I do believe that we should be handing out fines if people don't wear a mask during a surge of COVID. I think the other piece though, when you talk about contact tracing, it's once you're in a surge like they have in parts of the Midwest, in Texas, in Iowa, in North and South Dakota, contact tracing is out the window. You do not have enough human resources to do that contact tracing. It's just too overwhelming. And one of the pluses of being in Delaware County with this small count is that they are able to do contact tracing. And when you do the contact tracing, so if I know that I find out that Phillip is COVID positive, I can then find out who he was around and I can call all the people he had contact with over a period of time and alert them that they need to quarantine. So let's say that he had contact with 5 people here. You're then talking to them and the contacts they had. So you can see that this can be a heavy load and can quickly get out of control when you have a surge where I want to say I saw that over 50% of people who are coming in for COVID tests in North Dakota are testing positive. You can't keep up with that. So I think the policies that we've done, the policies around this have been too little, too late to a certain extent. I do think the micro-cluster approach, where we're not going to shut everything down, but we do expect that, you know, if there's a cluster of COVID cases in this one place, that we need to go in and be very strict with what kinds of policies we're putting in place there or what our expectations are.
I just want to jump in and say I talk to the people from the health departments as often as I can. And I try to focus on the really rural health departments because we have fewer news sources out here in the rural Catskills. And so to some extent, I trust that, places that are a little more populated have more reporters calling, they have a little bit better news communication going on. So, I try to check in with like Sullivan, Delaware, Schoharie County, where people aren't looking as much. And it doesn't take South Dakota levels of positivity to overwhelm a small health department. The people who are working in the Delaware County public health office have, I just got their update just now as we're talking. I got their update on my phone for today. They have 7 new positive cases. That doesn't sound like a lot, but they have been so overwhelmed with contact tracing that the state is already stepping in to help. And Sullivan County is in the same boat. The state contact tracers are stepping in to help the little health departments. And this is something that, we talked to them early on in the pandemic, that they adamantly said they did not want. They did not want the state to come help them. They know how to do their job. They felt like they had their system. They know their community. They know how to do contact tracing in the community. And I think that's true. So when you hear them say, we're overwhelmed, we can't do it, we need state help, that is a real wake-up call, even though the numbers, you get number fatigue and you don't know what a number means, and 7 doesn't sound like a big number. But if you think about how much work it is to monitor every single contact that those 7 people have been in contact with, and all of the businesses that they may have been working in or visiting, it is an overwhelming job. The health departments have been at it for months and months now, and they are very tired and very stretched thin.
And they also provide support for the people who must quarantine or isolate. Quarantine means you stay home. Isolate means you're staying away from the rest of your family. You're staying in your bedroom and everybody's wearing a mask in the household. And so if you're by yourself, how are you getting food, et cetera? So they have been also providing the support that people need to be able to quarantine and to isolate as necessary.
Good question that just came in the chat. How do we enforce mask mandates or really any kind of punitive measure, enforcement measure that doesn't disproportionately impact unhoused people or people living in poverty or people who are often sort of the first point of contact for law enforcement? Wilfredo.
If I may, as we all talking, I mean, one of the things that I hear, the many things that we've been hearing since the pandemic hit in early March is stay home, quarantine, social distance, contact tracing, clusters. Now, let's talk about the Hudson Valley, and let's talk about the number of diverse groups that have moved or who have been living within our area. That culture and traditions becomes basically an obstacle to apply some of this. Now, the other piece, the other way around, is the number of immigrants from where we talked about social distance or quarantine, where one family of 10 or 15, or maybe unrelated, are living in one room. So, again, I don't know where you are, but I had to tell you that we're in the Hudson Valley region, and then we jump to Long Island, then we go to the 5 boroughs, and we still find in those situations where it is true that we are trying to come up, as Dana mentioned, he said, I think that we rushed into creating policy, because when it comes to create a policy and then to implement those policies and then go into the mask wearing, my bottom line is, how much do we know the population that is surrounding us? How much have we done any, I will say for sake of word, any community mapping per se? Community mapping that can definitely give us an idea of who are our neighbors, how do they live, what do they celebrate, what are the things that are prohibited? Because remember, religion is one of our biggest obstacles, and we cannot go against that. So the bottom line is, how can we create tools that can be sensitive culturally, linguistically, in all those isms, that we can then start talking about how can we implement it now? Because again, At the end of the day, it's about respect. It's about being sensitive, because it's not, we're driving in panic. We've been on a panic mode since March, and we're still in a panic mode. And guess what? We haven't been able to calm down because now the numbers are going up. So now we had another panic mode. But when is it going to be that time that we're going to have to come collectively and said, okay, now let's look at the bigger picture, taking into consideration those points that I just mentioned, in that really describe who I am. I'm not just a piece of meat. I'm not just a number. I am a human being that has certain quality that makes us different, but that brings us together.
Wilfredo, I think it's a really good point. And I would argue that we wouldn't be in such panic mode if we had had leadership at the national level that had followed a plan that was already developed and in place. We knew what we needed to do, and it was not done. There was preparedness for this at a national level. The other thing I think that to point out in response to your question is, I think people who are essential workers, people who can't work remotely, who are out there with a lot of contact and maybe don't have many options, it's particularly challenging for them. And I hear you about this issue of what do you do about if you had people fined who weren't wearing masks. What do you do with low-income people? Well, I don't know what else you do. I just know that when my husband refused to wear a seatbelt and we got stopped by the state police and we got slapped with $150 fine, he now wears a seatbelt every time he gets in the car. So I don't know what the answer is, but yeah.
I've been intrigued and sort of following, a little bit along with the research on, what works. Does enforcement work? Because there's a real temptation, if you're worried about a behavior, to take that tool and say, well, you know what, we're going to fine people, we're going to arrest people, we're going to crack down on it. And that often does follow a really predictable trajectory where you get, that enforcement ends up being focused on people of color. It ends up being focused on marginalized people. It ends up being focused on people that can least afford to change their entire way of life in response to these incredible challenges. But there's another question there. It's like, what is most effective? And maybe in some cases it's enforcement, but maybe it's in some cases New York State's gotten a lot of flack for enacting policies that it can't enforce. But there is some evidence to suggest that just enacting a policy and saying there's going to be a $10,000 fine on this, even if you never issue that fine, that just having the policy and saying, no, you have to do this, that gets a certain number of people to comply, and that boosts public health. Mm-hmm. There's also this thing about shame. You hear a lot of shaming of people for not taking certain behaviors. And we saw that a lot this summer with photos of beaches. People were being shamed for going to the beach. And that, for my money and for, I think, a lot of people in public health, that proved to be incredibly backwards. Mm-hmm. Because going to the beach is about the safest thing that you could do this summer. Mm-hmm. From a point of view of socializing safely with COVID-19. If you're outdoors and the sun is shining and the wind is blowing, and you're not really getting up in someone's face who's not in your household, it's a pretty safe thing to do. And so when you shame people for being outside in a group or in Central Park or, at the beach or whatever, what happens? But people socialize indoors where it's much more dangerous, where they can't, be taken photos of and shamed in the newspaper. So it's a tricky balance, I think, between enforcement and public messaging and, kind of enacting policy that shows that we take this seriously.
And I agree with you. And there is a whole science around public health communication and crisis communication. The problem has been we have not had a consistent message. We have gotten missed messages in the past. The past federal administrations have used the CDC to be the consistent voice. They know how to do the messaging. They know what the messages should be. And that got thrown out the window. So I think we're trying to clean up from problems that were created by not starting off with what we knew needed to be done, at least the public health experts know needed to be done. We didn't go there, and unfortunately, it's left us with a bit of a mess.
So I think, the next thing that's going to take more messaging from the federal level and coordination is going to be the vaccine. And we'll talk more about the vaccine in depth later in the conversation. But I want to ask, I want to bring in two questions here for Wilfredo and Jonathan. Governor Cuomo has been let's say, lambasting the president and the White House's vaccine distribution plan, saying it's going to leave low-income and minority communities behind. Do you think there will be problems locally with some communities not having access to the vaccine? And how can we prevent something like that happening? I'll start with you first, Wilfredo.
That's a very good question, and I'm glad that the conversation is going into what's going to happen to those folks that are on the totem pole, right, the bottom. As a community health center, founded basically by 5 African-American women in the 1970s, and those women being from a community, African-Americans, I should say. Creating a community health center that during, back in the days, it was like a $10,000 budget. And today we're looking at 250,000 patients. And making sure that those individuals that very often are the marginalized, the one that perhaps because they don't come to the health center doesn't mean that they don't want to, but it means that we may have to go to them. I think that our philosophy and our mission is to meet the individual where the individual is. And as a community health center that basically is also online to be one of the designated places for the vaccine, one of the biggest deal for us is to make sure that our community is not left behind. Although you also have to make sure that your provider, your essential workers, right, are in good stand and good health as well to be able to care for those that we need to care. But I think that it is something that is it's programmatic. I think that will have to do also something to do with the institution. It had to do with the experience. And I think that one of our experience, and you can look it up, is basically how our work has been mostly within our community of color, our immigrant population, are the community who are basically, like you said, the one to receive the last thing, and that is something where we definitely had to be proactive. But at the same time, we're going to have to really also have our community speak up, because that could happen. That could happen because the whole world is waiting for this magical vaccine. And you know how we human gets when things like that happen. We lose our minds. But I think that it's just maintaining that mission that you have, and putting it into practice as a community health center.
So, Phillip, I'd say a couple of things. First, when the president gave his comments on Friday and basically said all 49 states can have it, but not New York. I guess we might have to, someone may have had to be concerned about that through January 20th when he's not the president. But I might point out that the headquarters for Pfizer is in New York City. The headquarters for Regeneron is in Westchester. Corning Glass is where the vials are made for the vaccine. We have a few things in bargaining for that, but I don't think it'll come to that. Your question is really, when it gets here, how is it distributed, and is it distributed equitably? I cannot speak for prior to COVID and trying to right every wrong of equity. However, I would say that since COVID and being involved in a daily phone call on what the state is doing and having not missed any of the governor's briefings, while there is a need to remain vigilant about it being distributed equitably, I come out right now saying it's hard to imagine that it wouldn't be in this state.
I'm really heartened to hear the state talking about the issue of equity and distribution, although I really have to question why they're not talking about rural in that, at least not much so far.
Well,
I think it's absolutely a fact that both low-income communities of color in more populated areas, also those communities, especially in rural areas, and also, you know, mostly white communities in rural areas have seen loss of healthcare and have seen the closing of hospitals and have seen the underserving of low-income populations. And this is another piece of this. So I really hope that that is on the state's radar. It hasn't been, you know, among the things that Cuomo's been really hitting hard in his talk about the issue. And I do appreciate him bringing light to the issue because we need to be thinking about it. But I think there's more dimensions here that are also, especially with the Pfizer vaccine, which is going to be proving to be a real logistical challenge to distribute outside of very populated areas because it has to be kept at this ultra cold temperature that you cannot achieve with a regular refrigerated truck. You need dry ice, you need special freezers. It is intense.
So I do want to say that New York State has a document already. It has an outline of a plan for the vaccine distribution that's pretty thorough. They're going to have to update it as we move forward, but it already has places around the state, including in the rural areas, that will be sort of the regional distribution centers and be able to handle that refrigeration. I agree with you, Lissa. There are logistics because, for example, the Pfizer vaccine will be packaged, they're saying, in 1,000 to 5,000 doses, and you're only supposed to open this package so many times and what have you. So I think logistically, the management of the protecting the not having this vaccine be denatured. So how it is shipped, how it is handled is really crucial. But already I know there are discussions going on at Margaretville Hospital about their role in distribution of the vaccine. And so I think that I think that there will be opportunities. I think the rural areas will be taken care of. I think I'm also hopeful that the state developed a list of priorities for distribution of the vaccine. And there are 5 different categories. And I won't go into detail about them, but I want to just say, and I noticed there was a question about children and teachers. I hate to tell you, but school personnel are in the second priority, which is pretty good, but all adults and children are in the last priority if you don't fit in one of the others. And so the first priority category, though, is healthcare workers, EMS, for example, long-term care facilities, and both their staff and patients, and the staff who are working with high-risk and COVID-positive patients. The second priority is first responders, school personnel, public health workers, other healthcare workers like pharmacists. The third category is people older than 65 or people of any age who have a lot of the comorbidities and are very high risk for getting serious illness from COVID. Then the fourth category is all essential workers. And so, Wilfredo, you know, for many people, they're holding some of these essential worker categories, or they fit into that category. And so I actually would have liked to have seen them bumped up a bit. But again, we're going to be dealing with a limited supply of the vaccine. And then that last category is healthy adults and children. So I'm, in response to the one question, I'm not even sure that all children will get vaccinated early on. I don't think they will be in the priority 2, where teachers and other school staff are getting vaccinated. I think it's recognizing we're going to have a limited number of doses to start, and not everybody's going to have access to the vaccine right away. So I'm pleased that they have these priorities and they're thinking through this, and I'm hoping it'll be a model for the rest of the country of equitable distribution, but I may be glass half full of a person.
Well, we can talk more about the sort of long-term public health outlook maybe a little bit later. I want to shift the conversation now to talking about the economic impact of the pandemic and bring Marybeth in. Restaurants have been among the businesses hit hardest by the pandemic or by the regulations around it. We've heard calls for restaurant bailouts, and public health experts say with increasing urgency that indoor dining is dangerous. But so far, New York State has tried to avoid shutdowns and kind of tread a middle ground with restrictions on capacity and hours. How is that working for local businesses such as yours?
Well, I can only speak for mine. And it's, I guess flexibility is absolutely key. Being able to adapt to the new protocols and the new recommendations brought by the state. Obviously, I'm a business owner, but I do feel that the safety of our guests and our staff are paramount, and that we're going to get through this entire crisis together. So I like science-based information, and when our governor makes science-based decisions, I feel better about it. However, I mean, they just recently closed the restaurant to 10 o'clock. So it almost feels like Governor Cuomo's like the dad driving the station wagon. When a few kids misbehave, he pulls the car over for everyone. And in some ways, I feel like I've been lumped unfairly in a group because we have been very responsible ourselves and making sure that we're even less than 50% occupancy. Obviously, all of the COVID protocols of gloves and masks and PPE for all staff, including culinary. So we feel like we do suffer a little bit because of these rules, but we're all in it together. Being able to be flexible and predict what might happen has been the hardest challenge, because as a business owner who loves to, after 18 years, it's a very predictable business in the sense of our, peaks and valleys up in here. But now I could either head into the busiest winter of my life with great social distancing kind of sports like hiking and skiing that the Catskills are known for, or I could have the worst winter of my life, being that we go through another shutdown and I worry about my 30 members of my team not having an income,
Someone just dropped a question in the chat for you that you may have just answered, but it sort of picks up on what you were just saying. What would a ban on indoor dining this winter without any sort of subsequent economic stimulus, what would that mean to businesses?
Oh, it would be really horrible without any type of backup for my team. Because I have 30 staff members, and to go to a takeout only model, we could maybe keep, a quarter of the staff on hand to support that business model. So a shutdown in indoor dining would be very detrimental to my business. But I mean, we're ordering canvas sails and some patio heaters and trying to make outdoor dining feasible throughout the winter for our own self. I know that I can only speak for my physical structure, how I can adapt my location to service people appropriately and safely. But it would be very difficult.
Mm-hmm.
Can I ask Marybeth about what you've done with airflow inside? I mean, I know you've really worked to to stay outside and have the social distancing, et cetera, and have been really good about that. So I'm thinking, if it were a very wintry evening when even the heat lamps might keep
Sure.
outside, have you been able to make changes in your air system? And if so, has that been an exorbitant expense? And I'm wondering about how businesses can really manage that.
Yeah, I am in I've got 6 separate dining areas here. So it is a very unique location in the sense that I have a 200-year-old farmhouse as the original structure. So it only has exposed beam ceilings. There's no central air that goes through the entire restaurant, which actually, I mean, each room has its own system in place. So I can kind of make sure that I can control that. Keeping fans on, windows open. I love, having windows open and heat on at the same time. My propane bill is terrible, but
Yes.
yeah, it's just dealing with what we have. Yeah.
Yeah. I mean, it's something I wondered about, whether there couldn't be some part, as part of a stimulus, a way for businesses to, whether it's purchasing a HEPA filters for rooms like yours, or HEPA fans, or
Sure.
making other kinds of accommodations. It seems
Right.
to me
We've looked into
that
that with the fans with the UV treatment on the top of the fans that actually, change the air. A lot of that. I totally agree. We would love to have some help. We had the Small Business Association loan to help us in the summertime buy picnic tables and patio heaters and be able to expand our outdoor offerings that way. We've had to build structures for this. So yeah, it's been very expensive to keep up with all of the changes, but you want to make good changes.
yeah.
I mean, someone did come to me and say, I'll build like a bubble around your deck. And the cost of that was more than I paid for the building. So I don't know if I can make these permanent changes and then go through a quarantine where I can't even use them, so it's just making smart changes.
But
And
also,
I was just going to say that somebody I know on Facebook posted a picture of a bubble around a table in New York City and was saying how great this is. And I thought how horrible it is that you're in a bubble and somebody
Right.
else has been in there and now I'm going to go in it and you're not necessarily disinfecting the whole thing. I don't think so. So
Yeah.
wise
just
woman.
because you're cold does not mean you're outdoors. If you've enclosed a space, even if it's with plastic and canvas, whatever, it's an indoor space if air isn't getting
That's
into
right.
it, which is so challenging for restaurants. And there's little guidance out there.
Right. Well, I heard that 2 walls need to be open if you have, of the room. So one of the interesting things is that New York State doesn't dictate what constitutes a wall, So I could have an art installation that kind of looks like a wall, but it still allows for lots of air to go through. That doesn't let every bit of heat that I'm paying for out. I mean, we're trying to be clever and smart. We obviously want everyone to be safe above and beyond everything else, but just figuring out how to stay alive in this business has been a very stressful time.
And did you get funds from the CARE Act in the spring? Did you partake in that?
We did with the Small Business Association loan. It wasn't like any type of grant. I mean, I'm paying the money back when they ask for it. And I did the PPP loan to float our staff during the time that I couldn't bring them all on board. And that was really very, very helpful. But at the same time created some anxieties because the unemployment and CARES Act extra money for staff was more than what I could offer them. So they had to make determinations for themselves whether or not they wanted to come back to work or make more money staying home. But some of them lived with multi-generational families. Everyone has their own. I couldn't blame anybody for whatever decisions they made, but we were fortunate that we've got a very loyal crew here, and I'm very lucky.
So what percent did say I'm just going to take unemployment?
I would say about 30%. Which was, substantial for the team. But at the same time, it allowed us to, we didn't have work for them during that time anyway. I mean, I didn't want to risk having people in the building. They were just going to get, a check and that's all they needed to stay home and do. So, and then it's hard for the people that actually show up and work. They're like, why am I coming to work and getting paid when I could stay home and get paid, So it required, the goodness of everyone, seeing that this is what's going to get our business that has been, good to them, hopefully, to keep us alive. And we're very grateful.
I've got a question for Jonathan about the economy. I think the economic picture has gotten a little bit mixed recently. There's more and more national data showing that the recession that we're in is fundamentally a service sector recession. Spending on goods has been okay, but that obviously has implications for this region where tourism and services are kind of the main main industries. But earlier this week, the Kingston controller predicted that this year's sales tax revenue is only going to be down about $500,000 compared to last year. Earlier in the spring, they were predicting 2.5, 3.5 million. And I think that the picture is similar elsewhere. I think it's actually even up year over year in Sullivan County. So what's your theory about what's going on?
So a couple of things happened. So first of all, the controller or whoever was in charge of making the projections looked at it, and honestly, based on what was happening in March, April, May, was probably making an assumption of the worst case. I mean, I think we have a little, I don't know that everyone collectively remembers March, April, May, and how we were the first state. We didn't know what was happening. There was no playbook. And so I think a lot of the projections were driven by what was the worst case. Now, as the weather got warmer, and to Mary Beth's credit, and many of the restaurant owners learned to pivot to say, gee, we can do outdoor dining. We can do takeout. There are actually some restaurants in my community that are doing better. That is not the norm. Make no mistake about it. The restaurant industry was hit very hard. But they've actually done better because there are more people who are at home and need food and have some means by which they can go to that restaurant. So what happened was, I don't think anyone predicted the amount of people leaving New York City, coming up to our region. Our open spaces, our parks were packed. And that means purchase of gasoline, stopping where they could to get something to eat. And actually, we wound up with a not bad, not by any means what we're used to, but not nearly as bad as what we thought it would be. So I think there were a couple of things that worked in our favor. The whole, and you know, I can bring it up now, which is what happened in New York City was it's similar in a way to 9/11. In that it was initially driven by fear. And it was, initial reports were high density was bad, as opposed to it was an airborne virus, and therefore that was the issue because you're in closed quarters. But that there was this enormous movement of people to the Hudson Valley to see about the purchase of homes. Now, I say enormous because in my 25 years of being here, I haven't seen anything like it. But that also resulted in a couple of other things that occurred. People came up here to escape New York. They had money. They were able to purchase houses. These are people of means, so they were able to help small businesses or restaurants because they were willing and had cash and could go out. But there is an issue there because our supply of housing, and especially affordable housing, was never great. And people were snapping up housing in the Hudson Valley and paying ridiculous prices for it. No one would pay these prices, but people in New York City wanted a place to get away to if this should happen again. They didn't want to be caught where they were in New York City. They didn't have another home. So what's happening is, you know, and I'm combining a couple of thoughts here, is that they were coming up here, and I don't know yet whether this is demographically a real number. Is there a purchase of homes? Yes, but are they really primarily going to be second homes, or are there people going to live here? And honestly, right now, it looks like we're talking, you know, in the couple of thousand, which was enough to eat up a lot of the inventory. It's not tens of thousands of people relocating to the Hudson Valley, but our supply was small, which meant that it increased the price. So people looking for affordable housing is going to find it very hard to find it unless we start building more. But that's what happened to the projections. They projected the worst, and it wasn't as bad as people thought it would be due to a variety of influences on those numbers.
Jonathan, this is we're seeing this in the Catskills too, not to the extent, I think, as in the more towards Ulster County and then down on into the Hudson Valley, but we're certainly seeing the same phenomenon of the houses getting snapped up and the real estate prices rising. Now, this is colliding with another trend that was already well underway before the pandemic, whereby properties that might have at one point in time been rental properties were on the Airbnb market instead, and just leaving almost no rental market to speak of in a lot of these areas. And then even in more urban areas like Kingston, it's become increasingly challenging to find a place to rent that is remotely affordable. And I think you guys have done some research on that.
We've done a lot of work. We do specialize in trying to figure out the affordable housing issue in the Hudson Valley. And yes, the Catskills, so Sullivan County, Ulster County, Greene County being part of that. It's a supply issue, and it's one that has been driven for a decade of decisions by local planning boards, zoning boards, et cetera, saying we don't want to build affordable housing. And right now, no one predicted that all of a sudden some giant wave would come and eat up everything. That was, I can't believe the kind of housing in Sullivan County that people are paying $100,000. It's a house valued at $200,000 and they're paying $300 all cash. And yes, it's taking it. And Lisa, there's something else that's happening, which is so people who got hurt by the value of their house back in the Great Recession, 2007, 2008, finally see the number of what they bought at being now available. So they're selling, but they don't have a plan for where to go. Mm-hmm. And we don't have, right now, I wish towns would be doing projects for affordable housing. And that's really the answer to gentrification, which is expanding the supply. It's not that the gentrification in and of itself is bad, displacement is bad. And, that's always been the position of our organization, that when it leads to people not being able to live where they are, that's a bad thing. But to the degree that people can purchase homes and therefore invest, bring their business, small business, the whole nature of work is going to change. And Phillip, if you really want to talk about the economy, that is the $1 million question right now, which is New York City matters to New York State. 30% of New York State's revenue comes from New York City. The tourism industry is absolutely decimated and will take years to come back. And that revenue is a major problem in making it up. And if you want to know one particular entity, the MTA, moving poor people around the subways, it's on the verge of bankruptcy. And unless there is a bailout that comes from Washington that will enable it to work, I don't know what they're going to do. There was I forget the number today, several thousand employees are potentially going to be laid off at this point. The rail lines that go in from the Hudson Valley to New York City, they're at 25% occupancy. If you sit on Metro North and there's 6 seats, 3 facing each other, generally my friends tell me they can have their pick of the 6 seats. Because partially they don't want to go back into the city due to the virus. On the other hand, they don't have to. This notion of remote work is going to dramatically change this, but I don't know where equilibrium is. There are businesses that clearly want their employees, when it's safe, to come back. And then there are employees that say, but why? I could have a better quality of life. And that is really one of the things we've tried to sell in the Hudson Valley for years, which is the outstanding quality of life, the ability to go outside and walk around for a little bit. And I think this is going to change where it's going to, equilibrium is going to be somewhere in the middle, where you got to go into your workspace traditional, 2 days a week, 3 days a week, and then 2 days a week, you probably can stay home. And that's going to be one of the great outcomes of the pandemic, actually, which is the changing nature of work. Then there's a whole nother issue of, do we have a workforce here at all, which was a problem pre-pandemic.
Yeah, we got a lot of questions, as you might expect, about housing and demographic shifts. I think it's too soon to say at this point whether these people coming from New York City and other urban populations are permanently relocating, or if this is, temporary and they'll realize they miss New York City in the middle of next year or something. But I'm wondering, certainly we are seeing the demographics shift, at least this year, and I'm wondering what those sort of downstream effects might be. I'll ask this question of you, Jonathan, from like a sort of economic and school standpoint, and Marybeth, I'm wondering what you might think the long-term effect of the changing nature and volume of tourism would be on local businesses. Let's start with you, John.
All right, so let me just start by saying, in the last 10 years or so, the population of K through 12 in the Hudson Valley has plummeted. It's plummeted statewide, but on average, 25% per school district. We have the ability to absorb whatever might move up here. It's not an issue. And then changing demographics. So the only real number, Phillip, that I've seen is that because who knows what happened to the 2020 census and how badly that may have been hurt, especially in Sullivan County. I think we're the worst in New York State, or the second to worst in the percentage counted. And so that people don't understand how that's tied to potential federal funding. And therefore, please fill it out. I don't know that the demographics are going to change dramatically from what was already happening. We were already changing. There was a growing Latino population. We're something a lot of people in this country can't accept. There is a changing nature of what America is. And it was happening in parts of the Hudson Valley. And it will continue to happen. But it's too early to say whether it's, a little trickle, or it's a giant wave, or it's like 9/11 where it happened and then it receded completely. What happened after 9/11 is somewhat interesting, is that a number of people from New York City who moved up here said the amenities that they were used to, and the ability that there would be 10 Marybeths on a single street wasn't to be found here. And some of the cultural institutions that you would find in Manhattan, there was a short subway ride, so they went back. So too early.
Right. I agree. Something that you had touched upon earlier about the housing situation is that this housing boom has been actually quite wonderful for a business that relied heavily on second homeowners. That, of course, my Friday night and Saturday night reservation book packed. Thursday night, it was like you could bowl through the place. But now my Thursdays and Mondays are full. I don't know if it's supply and demand. I've got very limited seating, but there are a lot of young families that are moving to the area. Now I can only speak to my microcosm of here on the very rural corner of Ulster County, but I'm the one thing that I think is going to be a different shift is the the internet accessibility. I live in my restaurant that I'm sitting in right now does not have cell service. And it kind of freaks out a lot of city dwellers that they walk in and they don't see a bar and they have to get on that Wi-Fi very quickly. Some of that kind of technology and connectivity is really important to keeping them up here. But one of the things that is the negative of the housing market, again, the affordable housing, I had staff commuting from Pennsylvania, Albany, Rosendale, like hour plus commutes to work at a restaurant job. And that's kind of unacceptable. I mean, it used to be, we had, you know, little apartments here and there, but as Airbnb grew in popularity, which is, you know, it's a double-edged sword for me because the Airbnb guests come to my restaurant, but now I don't have any place for our staff to live, you know, so it's, I know I can't have it both ways, but I'm hoping that the young families see the value in all the fresh air that we have up here and improving our school system so they stay in this area. I mean, I am a former city dweller that now am like the biggest advocate for moving to the Catskills, you know, because it's just a great lifestyle.
I'd be remiss if I didn't note that today, actually on the River, we published a story that looks at 3 recent reports, including one from Pattern for Progress, that sort of show the challenge of affordable housing and they get at that supply side issue that you were talking about, Jonathan. That's on our website. Now, I wanted to move to kind of an optimistic note to end the conversation about the economy on. I think one thing we've seen, and which has been much chronicled, is a rise in cooperation between nonprofits, a rise in mutual aid and other modes of community organized response to the pandemic. I know Peekamoose was one of, you know, a dozen or so restaurants that helped in the Mark Project's Feed the Frontline initiative, which delivered prepared meals to workers at Margaretville Hospital and Mountainside Residential Care Center. What can those models teach us about how to build like a more sustainable systems going forward that better meet the needs of low-income and marginalized communities who were suffering already in many ways before the pandemic?
I'll just say that this issue of equity has never been as prominent in the policy discussions that I have been having in all areas. To Marybeth, that everybody should have broadband access, even in the most rural communities. This issue of equity is a very interesting. Many decades ago, I used to teach a class on how do you measure government efficiency, and it was about the 3 E's. It was about efficiency, effectiveness, and equity. And somewhere we lost that. Whether it's about color, race, we lost it. And that I am optimistic that it will be part of a lot of discussions going forward. You know, that's my take on being optimistic about it, that equity will be part of these discussions, and we need to fix a lot of things.
Just a note on broadband, and this is getting a little bit into personal territory here, but my family business going back 5 generations now, my great-great-grandfather started the Margaretville Telephone Company in 1916 by stringing phone lines between farms in Margaretville. And there were 7 telephones in the village of Margaretville back then. So it was not in any way a real, you know, titan of industry. It's a much larger company now, but this is my family's history. And they are now involved in doing a lot of broadband build out in the region. And the broadband build out that's going on in New York State, I think you're seeing these tiny telecoms and ISPs jumping in a bigger way because, you know, in places where like Verizon and Comcast have kind of abandoned it. You know, Margaretville Telephone Company stepped up to do broadband build out in places where Verizon actually said no to state money to do build out.
Wow.
And so this is like, And in a way, this is sort of a bright side of historical inequity. Like you have this region, this piece of the rural Catskills that has been profoundly underinvested in, that has seen a lot of economic development pass it by. But what that meant is that, a small telecom like Margaretville Telephone Company get hold on and serve here, and it hasn't been like absorbed into Verizon, which doesn't care so much about the rural areas. So
Right.
So,
maybe we see some energy like this. You have this rural area, or you have low-income communities that have been left behind. Maybe the people that are stepping up to mutual aid and small business and nonprofit, they're in a better place to build out service to their community and to make sure that these inequities get addressed than the massive places that have been successful in territory that hasn't been left behind and underserved. I don't know.
So, the healthcare sector, I think, is also helping to push this because, of course, with COVID, we had to shut down many healthcare facilities, and people, and once you understood what was going on, you didn't want to go to see your primary care provider or step into a hospital if you didn't have to. And so for primary care practices, their volume and their revenues dropped dramatically, as have hospitals dropped dramatically. And CMS, the Centers for Medicare and Medicaid, stepped up and said, okay, we will pay for telehealth here. And then we realized, wait a minute, in rural areas and other places, like in New York City, in a housing complex for older adults who can't afford the internet and don't have the technology, it was a barrier. Telehealth wasn't available. And so there's been this real push by the healthcare industry that if we're going to improve health in a very cost-effective way, we have to build out that broadband. So those connections, I think, between healthcare and the other social factors, the economy and businesses, et cetera, I think you're right, Jonathan. And I think we're at this place on the issues of equity that it's like we realize we're all in this together. And either we look at the interconnections between healthcare and business and social services, et cetera, and education, or we stay in our silos and we fail.
I think New York, was it one day Governor Cuomo had the comedian Chris Rock on, and Chris Rock said, I didn't realize that I lived in the country of New York. And, I'd like to say that there are some very interesting things that New York does. I leave the media coverage of New York out of it. There are some really interesting, I've lived in New York City, I've lived in rural Sullivan County, and I've traveled into, I'm not going to say every county, but just about every county in New York State. And it really is quite a beautiful state if we can improve broadband. It's very interesting on the real estate. It has become, for the New York City people, one of the first questions they ask. Do you have broadband?
Interesting.
And in Dutchess County, one of the supervisors said, we have to say, no, we don't. And, but I think, look, my father was, lived through World War II, lived through the Great Depression. And while they were labeled the greatest generation, there was plenty that we learned in the 50s that they weren't so great about, how they treated women, equity, other issues. However, they were resilient. They believed that they could get through anything. I believe the people that are going through what we're going through now will be more resilient on average. Not everybody, I never speak about everybody, but on average, more resilient, the ability to get through things. Younger people, we are so quick to say all the negative things that will happen, but over time, I think they'll say, I can deal with anything.
Well, let's hope you're right. All right, there's some reader questions I want to get to, and I want to encourage everyone who's with us to get your questions in the chat. now. A couple questions about the vaccine that I'll direct to Diana and Lissa. What do we know about the two vaccines that we know anything about at this point, Pfizer and Moderna? What do we know about if people with compromised immune systems will be able to take it?
I don't have the answer to that. I know that they have included in the clinical trials older adults and people that do have some health problems, but I haven't seen anything yet about immunocompromised people. Have you, Lissa?
No, and I haven't. And I want to just note here that, we haven't seen peer-reviewed
That's
publications
right.
about either vaccine yet. What we have is we have preliminary results that they thought, okay, we have enough, and they planned for this. It wasn't like, oh, surprise, we have enough, we better hurriedly to get together a press release. They knew that when they hit a certain mark and they had a certain number of cases in their study, which had many tens of thousands of people in it, at that point they say, okay, now we look at these cases that we have across our whole study and say how many of them are in the people that got placebo and how many of them are in people that got the vaccine, because the vaccine isn't 100% effective. No vaccine is 100% effective. And then they say, they look at that ratio and they say, how we expect to see the same number of infections in the vaccinated and in the unvaccinated people if the vaccine does nothing. So if the vaccine works, we're going to see more cases in the unvaccinated people than in the vaccinated people. And that's what they saw. And they had a really good result in both the Moderna and the Pfizer trial, better than the researchers were even hoping for. So this is great news for us, but we don't know a lot about how it's going to impact specific populations. They are just starting to look at the data and say, okay, well, it looks like it's protective against older people. That's great. That's fantastic. There's a lot we don't know about what the vaccine, whether there's going to be that same level of protection in people who are immunocompromised, in children. There's a lot of questions that we still need to ask about different demographics and about people in different lines of work. And that work is ongoing, but we will get a chance to see more and more of that data as the vaccine makers publish it and as the scientific community gets a chance to examine it more fully.
Yeah, and I think so. The good news is that in some of these clinical trials in the past, they would not have included older adults. They would not have really tried to make sure that it's a vaccine that is available to a broad population. In the Pfizer trial, about 30% of the people are people of color. Just a little bit under 50% are people who are older adults. So that's really important because older adults don't necessarily have a strong response to vaccines. And the fact that they did respond to this vaccine, they were included in significant numbers, means that I'm fairly confident. We don't know how long this vaccine is going to last, though. So
No.
it takes 2 doses. And you can get these 2 doses, and we have no idea how long that immunity is going to last for. And I noticed that there was a question about something with giving antibodies.
Well, yeah, I was going to ask you that one. Yeah, does the state's guidelines do they say anything about how people who've had the virus or who have antibodies for the virus, how they'll be prioritized in receiving the vaccine?
I've not seen that at all.
Okay.
Yeah.
I would think that would add another layer of incredible logistics to what's already an incredibly logistically challenging process.
Mm-hmm.
Well, I do think that when I go to get a vaccine, I will be asked a number of questions, and my answers to those questions will determine whether I get the vaccine that day or not. I think people really need to understand that I'm not going to be first in line. I am not expecting to be first in line at all. And I think people need to understand that the priorities are well thought out. They will depend upon individual communities. If there's a hotspot in a community, they're going to target that community. And I think we just have to be very patient and understanding and know that we'll be screened in terms of our eligibility.
What does the latest science say about how long immunity might last if you've had the virus?
We don't know. It's for some people, it's lasting this period of time. Initially, they were saying 3 to 4 months, but as we push out, we're seeing that the immunity in some people is lasting for a longer period of time, and they're hoping that it will last for a year, maybe up to 2 years. But we also remember the virus can mutate. And so just because you've had the virus doesn't mean you shouldn't wear a mask, that you shouldn't take other protections. You have antibodies to that virus, that genetically structured virus. That virus, there can be a different version of the coronavirus that tweaks itself a little bit, and you could still get a second infection. Indeed, there are people who have gotten secondary infections. They are usually milder cases, though. So just,
right?
I'm sorry?
They're very rare. They
Yeah.
haven't seen a whole lot of reinfection, and that when you do see a case of reinfection, it tends to spark a wave of very scary headlines.
Yeah.
So I think that there's a sense that people might be afraid of this more than they need to be.
Well, I would argue we don't really know, Lissa.
Yeah.
I think the data's still out in terms of how long, if you've got antibodies to it, you've had COVID, you have antibodies, how long that will last, I think we're still not sure of.
I think it's clear people shouldn't, and I actually ran into somebody in the post office not that long ago who didn't have a mask on, and because I am that person, I'm like, hey, you got a mask? I do that, and I get some looks for it sometimes, but he goes, no, I had it already. And I kind of roll my eyes at him. I'm just like,
Right.
I guess I'm not going to the post office today.
Yeah.
But I think it's probably a bad idea to lean on, well, I had it, I can go anywhere. That's not my point in this. But also, something about the word mutation and something about the threat of reinfection, it looms larger in people's minds, I think, than just sort of getting an ordinary case. And an ordinary case is bad enough. We don't need to be freaking out about killer mutations more than we're already kind of dealing with the ordinary safety that measures that this new virus that we have to live with is imposing on us.
I think, though, it was Jonathan who pointed out that there's still a lot that we don't know about this virus. And so it was either Jonathan or I think Lissa. And I think that's what we have to keep in mind. And it's one of the reasons why it's complicated what the messages are, because the messages have changed as we've understood the virus better, as the science tells us.
So, Phillip, can I offer something to try to tie together some things that Diana said and Lissa said, and the economy and the vaccine? So, for right now, we're at a point where the virus is peaking. And there are those of us that might say, well, what happened 2 weeks ago? But I don't want to have that discussion with regard to people going out in large numbers, being in mass gatherings in different parts of the country. But it sure shows the spike occurring about 2 weeks later. And the spike is the highest it's ever been. Mm-hmm. So I think that right now, heading into the winter, we're back to ensuring that for all people, a lot of this conversation was about equity. So we got to make certain everyone has shelter, they have a place to live. We got to make certain that people have food. And the lines that I have seen, I have never seen images like this of cars backed up for miles trying to get food. People who never went to a food pantry needing food. Mm-hmm. The third element of it is access to healthcare on some level. And the fourth is either a job or a subsidy. So either you're working or you need some money to live on. That simple matrix of four things plays a major role between now and the till it gets warmer again. It's going to be a difficult winter, and there's no way to sugarcoat that. And although there's optimism about the virus, I think Diana, at least when it gets to the ability to distribute it, the ability for everyone to take it, for the ability of people to take it and, you know, not have any other adverse effects. We still got several months here at least to know the answers to those questions. So we've got, but here, you know, I'm looking for the glass half full here. We get back to the warmer weather. We now know, Marybeth knows how to take her restaurant and convert it so more people can take advantage of it. And we can hope that when we arrive there again, the vaccines are helping a little bit, or treatments are helping a little bit, but that also we've learned something, perish forbid, over a year, you know, that this is the second time. But I think we have to gird ourselves for the fact that most likely this continues on some level with us for most of 2021. Now, economically, it's very uneven. You mentioned, Phillip and Marybeth, that, you know, the Hudson Valley, Catskills, very dependent on tourism. There are some sectors that are performing really well. Supply chain, parts of manufacturing, the real estate, parts of the real estate industry, they're doing quite well. And, you know, that's why that next stimulus is essential. It's got to happen during the winter to help the majority of people in this country get through to where I think it gets a little bit better, a little bit easier. And then eventually, yes, the vaccines, the treatments, et cetera, reduce the fear. And then eventually that gets the viruses in our rearview mirror. And then we talk about, you know, the current catchword, building back better, you know, and we have to be serious about that.
Yeah.
Jonathan, I think you're absolutely right. And I hope we don't kind of abandon efforts to make sure that people have food and shelter and a way to live on the local level and on the state level while we're waiting for the federal government to get its act together, which it has demonstrated not a whole lot of, you know, inclination to do so. So, you know, we need to support our neighbors and our fellows in this, in our towns, in our communities, and in New York State, and in our families. So, you know, I hope we can all do that.
Right. I think I want to end on this. So, you know, we've been talking here about what is a widespread catastrophe that's laid bare a lot of systemic iniquities and injustices, but I think we're also maybe starting to see a little bit of light at the end of the tunnel. So I want to go around maybe in reverse order of how you each introduced yourselves, and just take, we're running out of time, so just one line about something that you're optimistic or hopeful about right now. That could be a specific scientific or policy development, or just something that the pandemic has revealed. Let's start with you, Marybeth.
Well, I'm optimistic that the people that have just relocated to the Catskills are going to fall in love with it the way that I did, and be flexible when we don't have Uber and Lyft and delivery and DoorDash, but in exchange for that, beautiful streams and mountains and trees and fresh air. And I think that's a pretty easy, you know, giveaway for me. So yeah, I want them to love it as much as I do and stay. So,
Jonathan?
I'm going to stay with out of adversity, I believe the human spirit thrives, and that there are a number of things that will change for the better over time. But over time, we get better.
Wonderful. Diana?
Well, I feel encouraged that a vaccine, I think, is on the horizon, and that during this time, We have made new connections. We have figured out different ways of doing things. We've figured out what our priorities maybe need to be realigned, how they need to be realigned. So I think if we can just keep wearing the masks and social distancing until we get that vaccine and support takeout or spaced dinners at Peekamoose, I think we'll be in good shape.
And Lissa?
I think that there are a lot of things that were wrong in our communities and in the state before pandemic that we weren't really paying attention to as much. And as awful as this has been, as hard as it has been, we are now having much more serious policy conversations about those things, and we're looking at them in a sharper way than we ever have before in my lifetime, and that includes the problem of local news. You know, pandemic has hit local news pretty hard. Papers were already shutting down and contracting, and having lost a whole chunk of advertising. That we're losing local news along with a lot of other businesses. This is your obligatory plug to support the River Newsroom, but also this is one aspect of problems that we are now looking at in a harder and in a more realistic way. And it is my hope that when we get to a better place with the pandemic, that we won't forget the lessons about inequity and about the problems that we've been ignoring, and instead use it as an opportunity to really engage with that stuff, which is hard.
And can I just say, I just want to endorse and thank the River Newsroom. I want to endorse what Lissa just said. I think if we all could provide support to local journalism, we'll be better off. We cannot live without local journalism. So I very much appreciate you all.
All right, well, you're saying it. That means I don't have to say it.
You can say it too.
All right, well, thank you all for joining. Lissa, Diana, Jonathan, Marybeth, and Wilfredo, who had to depart. And thank you so much for all of you participants who signed up and joined. We're going to be sending out a survey about how this went and what we should be doing with our pandemic coverage going forward in the coming days. So keep an eye out for that. And of course, if you haven't already, visit the River Newsroom. You can sign up for our newsletter. Everything is free. Sam dropped a link to donate if you're so inclined in the chat. We're very reliant on reader support. So thanks again, everybody, for joining. We'll end there.
Thank you.
Thank you.
Thank you.
Thanks so much.